My name is Amar Katranji. I'm a periodontist here in Southfield, Michigan. I'm here with my good friend, Dr. Mark McCawley from Florida, periodontist in Florida.
Yep, I came all the way over here, just braved the cold weather to visit Dr. Amar and get to see him do a lot of great procedures and get to learn a lot. It's a fantastic excuse to get out of the office. So
You came in the cold, obviously.
Yeah, of course.
So today we had a few patients that came in and they were interested in the All-on-4, but they weren't actually good candidates for the All-on-4. One of them had really healthy teeth, probably just needed a couple implants in the back to complete their dentition. And one of them came in and really didn't have much bone. They were more of a case that we had to set up. Do you have some cases like that you have down in Florida where...
Oh, of course. I mean, that's a lot of what we see. We see plenty of patients that are great candidates for the All-on-4, All-on-5 procedure, but not everybody's a candidate. That's just kind of the key thing here. Because
so for you, what's a good candidate? What makes a good candidate?
What makes a good candidate is someone with basically good bone, maybe a failing or an ailing dentition, teeth that you just can't save. And also edentulous people. You got patients that have been wearing a denture for several years and they just hate the darn thing.
Right.
And we're able to actually provide them with a nice fixed set of teeth, which is a great help to them.
Right.
But when it really comes down to it, we're in the business to save teeth as well. So there's a lot of our competitors out there that are quick to just pull all the teeth and place implants, but we don't do that.
Yeah, and that's what I saw today is this patient came in, had a lot of really good teeth, and really had a nice smile other than missing a few teeth in the back, and one or two implants kind of completes her smile. So it was good to kind of have this conversation with her and say, look, you don't need all of this stuff, all this work done, and we can keep her smile. Now let's say somebody's a candidate. How long does it take in your office from start to finish to go through the All-on-4?
Well, they start out, and basically if we can do the procedure, we'll get them booked pretty quickly as far as getting the procedure in. And after the procedure, they'll leave either with teeth or within a day or two. They'll get their own natural set of teeth here that are basically on those implants, and it'll look great, look natural. But it still takes a little while for those implants to heal. So you don't want to place the final restoration all at once, which again some guys do. You really want to let that tissue and let that bone remodel and shrink down, because after about 4 to 6 months there's going to be a little bit of a gap there. So that's why we like to wait that healing time in order to place the final restoration, which is going to fit great, it's going to look great, and it's going to be something that's going to last them a very long time.
Right, so they come to your office in one day, they leave the same day, and they have a better smile, and they have something that is going to make them feel better about themselves. See, that's one of the wonderful things about this procedure is it's really pretty quick. And for the most part, people don't complain about pain, right? I mean, you don't have a lot of pain and swelling.
No, I mean, it's crazy, because when you think about it, you're taking out a fair amount of teeth on some of these people, but it's rare to have someone complain about the pain, and it's great to be able to do that to somebody. Completely revamp their entire smile, their entire bite, and do it as minimal pain as possible.
So for some patients that have kind of wider smiles and less bone, sometimes we're looking at doing more work to get teeth in the back. We don't want to have 4 implants all the way in the front and then teeth all the way in the back, because then you get kind of a weaker, it's kind of like a building without a strong foundation. So occasionally we like to create more bone in areas where maybe we need to more support for the teeth. So it doesn't happen that often, but it does happen from time to time where somebody says, you know what, I really want a tooth all the way in the back. Even though it's not necessary, that's what they want. We're able to help them with that, but we have to do a little bit more work. There's a little bit more workup before we get to that point.
That is true. I mean, not every patient's going to be able to leave immediately with teeth. It's a vast majority of them, but some of them we do have to do some bone grafting and possibly some sinus grafting to rebuild some of that lost bone. And then we're still able to give them their implants. It just takes a little bit more time there, and it's of course not a majority of the patients, but every so often you'll see a patient that isn't a perfect candidate, but we can make them into a much better candidate with bone grafting.
Right, and if that person comes in and they have really short teeth and they tell you, you know what, everybody always told me I was a grinder.
Yeah.
Those grinders are the ones that we typically have to do a little bit more workup for. We have to make sure that we're placing the implants in solid bone. We have to make sure that their temporary is stronger than other temporaries. So sometimes we come along patients who just have a stronger bite that we have to make sure that we're addressing during their temporization.
And that's another reason why we like to place more implants as opposed to less implants.
Right.
For instance, I mean, all-on-4 is kind of the buzzword here, but we don't do all-on-4. We do all-on-5 or sometimes all-on-6.
Yep.
We like to over-engineer it because exactly for those cases. If you've got someone who's just grinding their teeth, 4 implants, it may not be enough.
Right.
And it's great to be able to still restore those cases, restore those patients to function, but you just have to place more implants.
That's right. So typically patients who don't have their teeth, if they go to bite into an apple or if they go to bite into something that's got a little bit more density to it, they're usually not confident in that bite. They're not confident in what their teeth are going to do when they take a big chunk of something. When they get into the all-on-4, they have something that's stable. When they're laughing, when they're talking to people, they're not worried about this stuff clanking around. And then they also don't have something covering the roof of their mouth. Right? So if you look at a palate, if the denture that has a palate on it, it's a big piece of plastic, and that piece of plastic prevents you from tasting things. It also requires a lot of glue and adhesives and chemicals and stuff to bond it so that it doesn't move around. So you don't have that so much with the all-on-4.
Yeah, the great thing is it's fixed because you mentioned previously with laughing and talking. With lower dentures in particular, and sometimes even with upper dentures,
Right.
If you're laughing and you're talking, that tongue is moving around. Those lower dentures have a great tendency to dislodge, and the last thing you want to do is when you're laughing is have your denture dislodge and end up on the floor.
Right,
so,
a lot of people don't even wear them.
Mhm.
They say, you know, Doc, I don't even wear those.
I don't even wear it. It's because it doesn't fit right.
Right.
And the great thing about this technique is you're able to make it fixed so it fits right. It fits the way it should be.
Yeah, so a lot of people come in and they say, you know, Doc, I don't know if I can afford this, or they might be afraid to even come to your office and talk about all these great things that we can offer them. And they might not realize that we do offer financing. There's ways to pay for this, you know, a few $100s a month. It's almost like a car payment where you pay this off over a period of time before you get your all-on-4, you get your procedure done. So you can get this done with just a few $100s a month.
Yeah, it's great because a lot of people don't have that big lump sum sitting around. It's something where it's so much easier to just take off little bites every month, and you're able to pay that down. That's where the financing really comes in, and nobody should be scared to come in to get it checked out because it's not a scary process. If you look at some of the testimonials that I'm sure both of us have online, you can see that, you know, it's not something you really need to be terrified of. I mean, come in, get checked out. It's not going to kill you, and at the end of the day, there's a good chance we can help you out and restore your natural function here. And that's at the end of the day, that's the most important thing.
Right. The more information that you have, the more prepared you can be in the future.
Mhm.
Right. So you don't go and buy a car all at once. You pay it over time. So
Mhm.
same thing as what we offer.
Exactly.
Right. If you're in the Florida area, there's nobody better than Mark McCawley, Dr. Mark McCawley, to do this.
Mhm.
Of course, if you're up here in Michigan, we're happy
Of
to help as
course.
well.
Yep.
So,
The best in Michigan.
Well, thanks again, Mark. I know you're busy and you got a flight to catch.
Yep.
We really appreciate you coming here to Detroit, Michigan, Southfield, Michigan,
Yep.
to see how we do things. And we're excited to come down to Florida and see how everything is done down in Florida.
Yeah, thank you. The invitation's always open. I think actually you guys are coming down in October, if I'm not
Excellent.
mistaken. So thank you for having me, allowing me the opportunity to watch you in your office. It's a great office. It's a fantastic office. And, you know, I learned a lot here. I learned a lot from
Thank
you guys.
We always learn a lot from you.
Fantastic. Thank you.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.